one of the most heartbreaking news or heartbreaking statistics in regards to healthcare have been coming from Kiambu the last two or 3 days. And the headlines state that 136 newborns dead amid Kiambu doctor strike. So Kiambu County has been having a strike, and the strike has gone up to 126 days, 127 days today being, if you count today. And over this period, the doctors, I think the nurses and the doctors are on strike. We have lost 136 babies, new babies, in Kiambu alone. So let that sink in. It's 126. It means like every day a kid is losing his life. A mother is going home mourning the death of their newborn, and it's strange if you see that when a mother is going to deliver in a hospital, they're actually going there with the hope of coming back with a new life. They have put their life on the line for the past 9 months, and now they get to the hospital where the government had assured them that they're going to deliver, and when they get there, they're not doctors. We have to agree that we are in a crisis, and it is a health crisis, because amidst all this, the share is not working. Yeah, the social health authority and whatever they do in that thing, they are not working. So it begs the question to the government, mostly the county government, also the national government, because level 5 hospitals, they fall under, I think there is a collaborative work between the national government and the county government. So for the Hopkins experience today, we are not really a happy lot. I'm saying this as a parent, as somebody who we welcomed our baby a few months ago, like last year, around 9 months. It's a beautiful thing to see when you walk into an hospital, then come back with a bouncing baby boy or girl. It's really nice. And it's also way heartbreaking for families that have gone into hospitals, then delivery rooms, then they come back empty-handed, actually mourning, not even empty-handed. They come back with a dead body, a dead baby. It's not fair. It's not fair what the government is doing. Not fair what the county government and the national government are doing. And you might want to blame it on the doctors, but I want to read one of the messages from the doctors who are in Kiambu, the doctors and nurses who are in Kiambu who are on strike, so that you can understand why they're on strike. So here is the DM I've gotten online, and it was from a nurse or a doctor from Kiambu. I'll read it. The doctors in Kiambu County have been on strike since May because hawalipwi. And before anyone comes at them, mjue, these people are like any other person. They need food, fee for their kids, for themselves, kama wamerudi shule, fare, wengine rent. So for the past 128 days, hawajaona a dime, but Governor Wamatangi expect them to resume work. It threatens to fire them. By the way, the strike ikianza early this month, the Ministry of Health threatened to recall interns wasipolipo. So Wamatangi said wakirudi, he'll consider letting them keep their job, bado hawajalipo. So all this strike is coming in due to pay. These doctors need to be paid, and we have to agree that Kenyan doctors are not well paid, no matter what you want to say. So even the little they are being paid, that is being given to them, they are not given on time, because you cannot, you are a whole doctor, a whole nurse, but from May to now you've not received any money. What will you do? You'll have to have a go slow. You have to go to have a strike. So, and they're striking over delayed salaries, poor working condition, inadequate funding in hospitals. It's bad, because if you see the amount of money that the government is using, the amount of money is using, even in printing alone, the amount of money the government is using for travel, the amount of money the government is losing in corruption, it's a huge amount of money. But if the government is really serious in addressing these issues, this money can be put to make sure their drugs, the doctors are working okay, and they're also well compensated. They have trained for all this. At some point, back in the days when we were still in school, one of the most admired profession was being a doctor, because they have a stature, they have a very big role in society. So it doesn't make sense for us to frustrate these people. Now imagine being treated by a frustrated doctor. Just imagine that a doctor who is depressed, a doctor who has financial struggles, a doctor who cannot feed himself, is there in their very nice white attires, white overalls and stuff. I don't know what they call them, and stethoscopes, I think, on their shoulders. But they have not eaten, they have not gotten money, they are in debt. How do you expect such a doctor to treat you well? It's a wake up call for Kenyans to see that we are being played. We are not getting what we really voted for. We are getting a raw deal out of all this, and the price is life. And yesterday I saw the president crying because Kenya won, and he's emotional and he loves Kenya. If you love Kenya and you're the president and you're the governor, we should not be having this kind of things going on in the country. And it's not about the doctors refusing to work. It's about a leadership failure. It exposes a leadership failure. If you let's start with even funding. Kenya has an underfunded in healthcare for decades, and we rely on strike as if the only way the doctors can be heard. Why should the doctors go into strike? It is something that should be settled in the boardroom, something that's better very fast before it gets into a crisis, because the crisis hurts people who are very innocent, taxpayers who've already paid their taxes, they paid their dues, now they just want to get services. But the fight between the government and the doctors puts us in a very awkward place, where we have to die. We have to arrange funerals for kids. We have to arrange funerals for our relatives, friends, just because of lack of doctors. It's life. I believe this government does not even value life. If it valued life, things would be very different. There's rampant corruption in the health sector. If you can remember when Mutahi Kagwe was coming in during the COVID times in 2020, back then, you could see him saying, even pointing at him when he was having a press conference, he was pointing at that building, the Ministry of Health, saying how many cartels are there. If a whole government cannot deal with those cartels in a ministry, and I'm very sure it's the government that is enabling these people to keep being in these positions, to siphon money out of Kenyans, to take the Kenyans money. I want you to ask yourself, if 136 newborn had died in the United States or in Europe, will it be a crisis? Would the government really survive the outrage where 136 newborns have died. We have not even gone to other cases. We're just looking at newborns. But here in Kenya, it's just a normal trend. It's a normal trend for kids to die. It's very normal trend for anybody to die out of negligence, out of bad governance and leadership. It's very normal. And at some point, even the government gets in and tries to kill you via guns. So it's not a good thing. It's not a good thing for us to have this kind of thing, especially for us parents. For me, I feel for the parents who have lost the babies. It's really heartbreaking. I know you have been there 9 months. You've bought clothes. You've told your friends about it. You've held a baby shower. Your parents have been supporting you over that. Then it ends up in a death. Not the death you really want. You from an accident or something. No, from the lack of doctors and medicine. Healthcare is not a luxury, by the way. If we look at our constitution, Article 43 of our Kenyan constitution, it says that every person has a right to the highest attainable standard of health, which includes rights to health care services, including reproductive health care. You have a right as a Kenyan to get the highest attainable standard of health care. It's because you are paying taxes. The constitution guarantees you a right to have better, high quality standards. Whatever you're getting in Kenya has nothing. It's not even, you cannot even rank it. You cannot rank it as healthcare. It's a death trap. Even going to it's better for you even to just give birth at home. Yeah? Give birth at home, have those midwives. There's no need, because even if you go get it safe, you end up paying more. So women are staying out of these hospitals, and it's not a good thing. When the Beyond Zero campaign came back then under the previous President Uhuru and the First Lady, the Beyond Zero campaign was to make sure there was zero maternal death and newborns, so that you can have that joy. Let people have this joy. Why are you doing this? You are actually depressing more people. It doesn't make sense. Yeah, it doesn't make sense at all. We have to find a way forward on how to deal with this thing. As Kenyans, we need to wake up. We need to change this government. There's no way we can continue operating in such an environment. It's high time the Kiambu government first comes in and addresses this strike immediately. It's an immediate thing. I'm saying it's because even Kiambu level 5 is very, very close to me. So if anything even happens to me or my family, I have to go there. So I can be a casualty of these bad healthcare services. It's really frustrating, especially for us young people who are coming up, and the country we were sold. It's not what it is right now. It's not the country at all. It's just a different country. It's a country that full of lies, country that does not even care about its people, a country that's full of PR rather than work. We cannot eat PR. We cannot be treated by PR. Yeah. The money that the government wants to spend on TikTokers to do something, then is the money they should be building. What is the government doing on social media? There's nothing you're doing on social media. Go down there and work. You have nothing to do here on social media. Let us common people to come on social media and say what we want, but the action should come from the government. So let me conclude this video on a very sad note, and I hope Kenyans come together. We at least we are seeing the impacts of the bad choices that we've been making. They're catching up really very fast with us for voting without really thinking about it, just going as if it's nothing. It's high time Kenyans take matters of electing leaders seriously. They take votes and they participate in elections and politics, because this directly impacts our life. Directly. We end up losing our life because of bad politicians. And when this government is out, we have to go back and hunt for this murderous regime. We go back and look at these governors who have been eating our money. Look at the president and his cabal of friends who have been milking the country dry. It's high time for us to bring some accountability into our system and develop a good country. We cannot be dreaming about Singapore every day. We have to make sure that we attain that Singapore within the shortest time possible. Not every time having dreams and comparing the country to other countries, but there's no action that is being taken. It's very sad. We have to just build Kenya the way it is. Build Kenya, better Kenya, without comparing. These comparisons do not make sense. Because if you compare, there's nothing even to compare. So, I want to end my video there. I'd also love to hear your thoughts about it. What can we do as Kenyans? Then does this news of us losing 126 newborns shake you as just a normal day for you in Kenya? Or are you even tired? Because this news are even tiring every time. Yeah. So let's keep engaging. Let's keep talking to each other until we find a solution. Thank you so much. I've been your host, Hopkins Keboy Malova. Till next time.